in today's session we'll be learning about fluoroquinones, where fluoroquinones are nothing but they are fluorinated quinones. So these will be having a wide spectrum activity, few side effects, lesser chances of resistance and better tissue penetration than the quinones. So they have a wide spectrum activity, so they can act on many bacteria and fewer side effects than the quinones and less chances of resistance. So what does that mean? It could some bactericidal agents could be easily resistant towards the bacteria. As the bacteria attacks, this will not show any effect. But fluoroquinones are not like that. These are less resistance. If the bacteria range is very high, this will not affect and it will compulsorily show its bactericidal activity. So now these are the less chances of resistance and better tissue penetration than the quinones. So the classification of fluoroquinones are, we'll be having first generation, second generation. In first generation, we have the suffix for fluoroquinones is floxin. Okay, floxin. So in first generation, the prefix would be nor and cipro, norfloxin and ciprofloxin. Whereas in second generation, same floxin will be coming and levofloxin, lomifloxin, gatifloxin and gemifloxin. So to easily remember, we'll be having words starting with letter L and G. Okay. So other things we have to by heart, so that lovifloxin and lomifloxin, gatifloxin and gemifloxin. So coming to the mechanism of action of fluoroquinones, as discussed earlier, it is bactericidal agents and inhibit the activity of DNA guidase. So what does this DNA guidase actually do? So what does this DNA guidase actually do? It is required for DNA replication and transcription. So it is mostly required for DNA replication in the step called transcription. So now what is transcription? Transformation of DNA to RNA is called transcription, no? So in the process of transcription, the DNA guidase is necessary. So bacteria with damaged DNA form degraded by the nuclease enzyme. So here you can see the detailed explanation that fluoroquinones will be having two actions, which is about DNA guidase and topomerase 4. So when the fluoroquinones are administered for the patient, in them the DNA replication will be going on. No, in that DNA guidase activity will be decreased and topomerase activity also will be decreased. So now we will be seeing about DNA guidase. When the DNA guidase activity decreases, it interferes with the correction of supercoiling of DNA, which is leading to the damage of DNA. So the damaged DNA will not be persistent in the human body. So it is degraded by the nucleases, which will be forming a bactericidal activity. What is happening over here? The DNA guidase activity is decreased by the fluoroquinones, which so normally when the DNA replicates, it will be having a supercoiling. So here the supercoiling is not corrected. If any errors is occurring in the supercoiling, here it is not corrected by DNA guidase. Why it is not corrected by DNA guidase? The activity of DNA guidase is decreased by the fluoroquinones, no? So the supercoiling of the DNA is not corrected, which leads to formation of damaged DNA. So in any body, the damaged DNA is not processed further. So damaged DNA is degraded by nucleases, which results in a bactericidal activity. So now the function of topomerase 4, it also decreases the activity of topomerase 4, leading to decreased separation of daughter cells. During replication, we'll be seeing the separation of daughter cells. No, so when the topomerase topomerase 4 activity is decreased, there will be no separation of daughter cells. Like it will be forming like this. There is no separation of daughter cells, which leads to arrest of multiplication. Cell will not be multiplied further. So it leads to arrest of multiplication, which leads to stoppage of the bactericidal production. Arrest of multiplication leads to stoppage of bacteria production. Now about antibacterial spectrum of fluoroquinones, which it attacks gram-negative bacteria, gram-positive bacteria and also anaerobic organisms. So coming to gram-negative bacteria, it arrests the activity of gonococci, meningococci, Haemophilus influenza, Escherichia coli, Salmonella, Shigella, Enterobacteria. So we'll just remember in some pairs. So cocci, gram-negative bacteria, we'll just remember them in a short forms like the cocci family, the cocci The influenza and E. coli pairing up to the same group, we'll be adding enterobacteria E there, no? So influenza, E. coli and enterobacteria becoming a triplet, and salmonella and shigella. Starting with yes, no? Salmonella and shigella becoming a one pair. So what are the gram-negative bacteria? Gonococci, meningococci, Haemophilus influenza, E. coli and enterobacter, and other pair is salmonella and shigella. Now coming to gram-positive, we have our very favorite staphylococci, which is very favorite in microbiology. Staphylococci, Calmidia, Mycoplasma and Mycobacterium. So we'll make these two a pair, and Calmidia, Staphylococci. Streptococcus will be having an anaerobic organisms. So what is the gram-positive bacteria which is present in the antibacterial spectrum of fluoroquinones? It is Staphylococci, Calmidia, Mycobacterium and Mycoplasma. So anaerobic organisms are Streptococcus and pneumonia. Coming to the pharmacokinetics of the fluoroquinones. So in pharmacokinetics, fluoroquinones are well absorbed and been widely distributed. See, while writing about pharmacokinetics, our HOD sir has given us a little trick about writing pharmacokinetics. While writing pharmacokinetics, we have to remember the word ADME. So that's not the spelling, but it's a shortcut of ADME, no? ADME, what does it ADME mean? Absorption, distribution, metabolism and excretion. So absorption, it is well absorbed. Distribution, it is widely distributed. Coming to the metabolism, it is metabolized by the hepatic microsomal enzymes. Hepatic microsomal enzymes. So in the liver, it is metabolized. So coming to excretion is by kidneys. So those should be decreased in renal failure, as the cleanup and clearance is by kidney. So the patients who are having the renal failure problems, for them when we are prescribing, the dose should be reduced. And adverse effects. The adverse effects, so first, mostly it is well tolerated. So fluoroquinones are better only, it's well tolerated, but some patients would have nausea, vomiting. So these side effects are the most favorite for pharmacology students, no? Nausea, vomiting, abdominal discomfort, diarrhea and rashes could be seen. And also tendon rupture can be seen, and fluoroquinones damage the growing cartilage, and CNS, headache and dizziness would be observed. Damaging of growing cartilage. So fluoroquinones are not recommended for the babies, like infants, because they'll be having most of the cartilages other than bones, because they'll be having cartilage on the growing bones, they'll be having cartilage on the brain where the bone is not completely formed. So fluoroquinones damage the growing cartilage. And also regarding to the central nervous system, it could cause headache and dizziness. So what are all the side effects of fluoroquinones? First one, fluoroquinones are well tolerated, but it could cause nausea, vomiting, abdominal discomfort and rashes and diarrhea. While coming to it also could form the tendon rupture, which is also known as tendinitis. So it also causes tendon rupture called as tendinitis, and fluoroquinones could also damage the growing cartilage. And also regarding to CNS, it also causes headache and dizziness. Now coming to the uses of fluoroquinones. See, here we can write all the bacterial problems which could cause. So except urinary tract infection. So what are the 5 main things you have to remember in the uses of fluoroquinones are urinary tract infection, typhoid, diarrhea, tuberculosis and some eye infections. From either than these 5 uses, all are regarded to the bacterial infection and also respiratory tract infection. As it is included in staphylococci, we will have this respiratory tract infection and bacterial infection too. So what are the main 5? Urinary tract infection, typhoid, diarrhea and tuberculosis and eye infections. So other are gonorrhea, which gonococci, gonorrhea, and canthroid and chlamydia, urethritis and cervicitis, chlamydia, gram-positive bacteria, and respiratory tract infections, bones, joints, soft tissues and intra-abdominal infections, which is normally seen in bacterial infections. Bones, joints, soft tissues and intra-abdominal infections. And also tuberculosis, bacterial prostatitis and cervicitis, same as chlamydia. But urethritis and prostatitis different, but chlamydia, urethritis, cervicitis and bacteria, prostatitis and cervicitis. And in eye infection could be seen anthrax, orodental infections. As we are dentists, we should write about dental infections, and meningococcal carrier state and gram-negative septicemia. So there are 14 uses, where the 5 main are urinary tract infections, typhoid, diarrhea, tuberculosis and eye infections, and respiratory tract infections. It also include bone, joint, soft tissue and abdominal infections and eye infections. So the other infections are gonorrhea, chancroid, chlamydia, urethritis and cervicitis, bacterial prostatitis and cervicitis, and then anthrax, orodontal infections, meningococcal state carrier and gram-negative septicemia. So now these are the uses, antibacterial spectrum, pharmacokinetics, adverse effects, and the classification of fluoroquinolones and mechanism of action. Thank you.